I'm here today with Dr. Sheila Mackell. Dr. Mackell is a pediatrician from Flagstaff, Arizona. She has practiced general pediatrics and travel medicine for many decades. She has published many articles in medical journals and many chapters in medical textbooks, so she's definitely authority on this topic. So thank you for joining us, Dr. Mackell.
Absolutely. Thanks for the invitation, Chris.
I thought what we would do today is run through a couple of hypothetical travelers. And maybe let's start with a family, a young family that sees you with their 2-year-old girl, Amelia. This family is going with Amelia to Thailand for a week over spring break. Amelia is healthy. She takes no medications, and she was born in the United States. Their plan is to fly into Bangkok, then head up north to Chiang Mai and Chiang Rai. And they're not sure, but they like trekking, and they may trek to the west of Chiang Mai on the Myanmar border. So first, before we get into specifics concerning immunizations and such, any general thoughts or framing remarks you would make?
Well, I think that their plan is auspicious to do with the 2-year-old, especially given that they're coming ostensibly from the West Coast and coming all the way across the ocean. That's a long flight. There's going to be some time zone jet lag issues. The 2-year-old may be up at all hours of the day or night and asleep at other times, that things that you often don't think about, but they may start by making their flight, if they haven't already, to fly in the evening or at the bedtime, so that there will be some period of quiet time that perhaps the 2-year-old could get during the trip. I think that's a big place to go for just a week, because it's going to take a 2-year-old a little bit of time. It's not that it's undoable, it's just they have to set their expectations in the right place.
Right. So this would not be the same as their honeymoon trip, during which they traveled by just the two of them.
Absolutely not. And
Okay.
perhaps if they have any ability to stay any longer, that might mitigate some of the hours of jet lag and time they have to spend. That may be pleasant.
So
But
seeing
if they're
if
limited
bumping
to a week,
this up to a 2-week trip, if possible, would make things easier. Okay, good point.
Especially with all the movement they plan. You know, there's cars, buses, planes, and trains that are all subject to delay.
Okay, good. Now, in terms of past immunizations, as I say, she was born in the US, and she's up to date on routine domestic immunizations, with the exception of flu. She had her last flu shot 18 months ago, maybe a while ago. Other than that, she is up to speed on domestic vaccines.
Well, I always start with vaccinations, because that's the most common thing people come to pediatricians for.
Mm-hmm.
So the routine vaccines, I would hope that she's up to date on her measles vaccine.
Mm-hmm.
And I would consider, since they are going a little bit off the beaten path, to consider doing her second measles vaccine,
Mm-hmm.
which you can do anytime 1 month after the first one. It's typically given just around kindergarten age, between 4 and 5. But once you're traveling, and if you're traveling in an itinerary that may be a little ill-defined or off the track, the second measles vaccine would be a great thing to consider.
Mm-hmm.
I certainly am a strong proponent of vaccinating against the flu and
Mm-hmm.
against COVID-19.
Mm-hmm.
They're going to be in close quarters on that airplane for quite a long time. And while the air in the plane may be fine, the times they spend in the jetways, et cetera, and a 2-year-old not being very amenable to wearing a mask, picking up flu or COVID-19 is certainly a trip ender.
Got it. So it sounds like flu and COVID-19, both high priority vaccines.
Yes, absolutely.
Okay, good. Now, and she's current on tetanus and polio. Moving on to potential travel vaccines, any vaccines related to her travel that you would advise for this 2-year-old?
Well, routine vaccines in the U.S. already include the 2-dose hepatitis A series. So ostensibly, she's already gotten that.
Mm-hmm.
If they are, depending for a short trip, for a 1-week trip, I'd be on the fence giving typhoid. If they are strict about food and water precautions and understanding where they're getting their food, where they're getting their water, the typhoid is a plus minus. There's not a lot If it was a 2-week trip, I'd absolutely err towards that. And for a 2-year-old, they only are responding to the injectable typhoid vaccine. They can't take the oral, whereas the parents could take the oral.
Okay.
And then the third one, I always add in a travel situation, and sometimes it's relevant. Now it's even more relevant because the schedule has been shortened. But the rabies vaccine is always worth talking about. Most people shudder when I bring it up. However, rabies, a bite, a lick, a scratch from an unwelcome dog anywhere, and we know that in Thailand the incidence of rabies is not insignificant. If they wanted to cover all their bases, and again, reading the room and figuring out if the parents are really able and interested in any protection they can get versus the what ifs. The rabies vaccine can safely be given anytime after birth. And in the series now, it would just be on day 0 and day 7. So they'd have time to get the 2 doses they would need, that if there was an exposure, they wouldn't need to hustle down to Bangkok or Hong Kong to get the rest of the treatment.
Oh, good. And what they heard something about Japanese encephalitis. Would that be appropriate for this trip?
You know, honestly, that is a great vaccine to talk about. There's 2 issues with it. Number one, there hasn't, that short of a duration trip is unlikely that you would be exposed based on travelers' data. However, Japanese encephalitis is a mosquito disease, so it brings up the time to talk about insect precautions. And the issue with JE on a short trip is that number one, it's quite expensive if their insurance plan may not cover it, and number two, there hasn't been an accelerated series that's approved for children to date. It's approved for over 18-year-olds, but for this short of a trip, I wouldn't recommend it.
Okay, good, thank you. Now they say, hey, what about malaria? Do we need a pill for malaria for our little girl?
Good thing that they asked. There's lots of steps before you get to the pill, the medication. One is protecting yourself with your clothing, and they could treat their clothing with permethrin and treat their skin with either a 2-year-old. You can use a DEET or preparation, preferably one that's 10% in the 10% range, and or picaridin is safe to use in children. Also is a little bit more environmentally friendly and not toxic to skin, to clothing as well. So skin gets treated, the clothes get treated. Bed nets, when they're on the areas on the fringe of their trekking times, if they have bed nets, they should think about having them. And then comes the medication. And first of all, I pull out the map of Thailand. And if you have the CDC's health information for international travel or their a web-based program, you'll see that malaria is all the way around the rim of Thailand. So Chiang Mai and Chiang Rai, it's common places where people go because of the elephant sanctuary that is in malaria endemic places. The malaria along the edge of Thailand, especially as you get close to the Cambodian and the Laotian border, tends to be resistant. So we do tend to pick a medication that's called atovaquone proguanil. The proprietary name is called Malarone, where it's best to offer the options. There's a once-a-week option, but that wouldn't be indicated because of where they're going. So unfortunately, a couple issues with giving malaria medication to children. There's no liquid form. So you have to crush it, you have to pulverize it, put it in a vehicle that's tasty, and remember to give it. It's an everyday drug, and so it's quite fragile. If you miss a day, you're not protected. So you want to make sure that you give the instructions on how to do that, which is basically a day before the trip, every day while you're gone, and for 7 days afterwards. And to also be sure to tell the provider, their providers, when you get home, if anybody runs a fever in the next several months, they do mention that they've traveled.
Now, how is the taste to a 2-year-old palate?
Well, it could be worse, is what I could say. Atovaquone proguanil is not the worst of the malaria medications. There's 3 others, and the other 3 all taste worse. And I can honestly say I've tasted them all because I've tried to give them to my own children. And if you pulverize it or put it in small enough pieces and try to disguise it with a spoonful of something, chocolate syrup, with a little sugar added even will help get that in.
Okay, good, excellent. Now, this young couple, when they went there on their honeymoon, they both got traveler's diarrhea for several days, and they ask you, hey, if our little girl gets diarrhea, what should we do? And should we take any medications in case that happens?
Well, most parents are really very facile at managing diarrhea in kids. So they know when diarrhea is present and when it's really bad. But it's also underappreciated how bad diaper rashes can be. And most 2-year-olds are susceptible to diaper rashes because of their toileting stages. So understanding that the most important cornerstone is hydration. With oral rehydration salt, you can get a little tiny packet at most places everywhere in the world for a nickel to a dime. It's not, you add a liter of clean water and have them sip it. Sometimes you have to add a little taste and flavor to it, but it's a little salty, but it does keep kids rehydrated. If you know that over the counter, you can see most places have anti-diarrheals. We tend to not recommend that in young children, mainly because of all the side effects that can occur. Young children can get a paralysis of their GI tract. And so we don't want that to happen. So you try to manage the diarrhea with fluids. You don't restrict their diet, except obviously no high fiber food. And if they're able to tolerate protein, that's wonderful. If they're sick enough to have blood in the stool, fever, blood in the stool, and the parents would like to take an unreconstituted liquid antibiotic dose, they may be able to talk their pediatrician into sending them with a dose of azithromycin, is our current favorite. And that tends to treat the serious diarrheas that cause blood and dehydration. Although most travelers' diarrhea does not need to be treated with antibiotics. We know that it needs supportive treatment just like you do at home.
So usually it's self-resolving.
It is usually. And if it's not, you've got sick diarrhea, and then you should try to find a place to have somebody check the child. There's plenty of excellent medical care in Thailand, and they should be able to find a clinic.
Good, good. Now, we've talked about infectious things so far with immunizations and vaccine preventable diseases and malaria and traveler's diarrhea. What within the non-infectious realm would you also like to touch on with this young couple regarding their daughter?
Well, let's start at the plane. Keeping busy. Something new every 15 or 20 minutes in the plane until their daughter's asleep is usually a good recommendation. There's little Play-Doh packets they can use, pens, paper. Always have some food and a change of clothing when you're in the air. I do recommend strongly consider taking your car seat. Car seats may not be available, they may not be present. Of all the exotic things we love to talk about in travel medicine, it's probably traffic accidents that are the most significant and more common. So bringing your car seat and perhaps if you're renting a car, a method to keep that car seat in the car, a webbing strap or something, unless you have some reliable source of transportation. Keeping everything labeled and keeping a hold of your child, not getting lost, not getting separated, making sure you've got sun protection, hats and eye protection, and lots of activity. You'll find that babies and kids, they're ambassadors for travel. They will enrich the trip tremendously, and the number one key is flexibility.
Got it. Got it. Okay, good. And in terms of jet lag, sometimes adults take melatonin or do other things. Anything you would recommend for someone who's 2?
Patience.
So you say stay away from pharma.
Yeah, melatonin and Benadryl and sedating kids on planes, it's all not recommended, not tested, not reliable enough to say do this. So okay. You know your child, you know the best how to adjust their sleep schedules, adjust their nap schedules, and that may require being flexible with your itinerary.
Good. And after the trip, suppose everybody feels perfect. Any screening necessary?
No, I don't think there's nothing recommended, not for where they're going.
Okay, good, good. Well, before I go on to our next hypothetical traveler, any other thoughts on our young traveler here?
I would just want to get a follow-up. I would love to hear. I always find the beauty of travel medicine is that you get a follow-up on how everything went. And not only does it help you hone your advice and give you more experience, but it also just enriches your own knowledge base of all the possibilities in the world. And people are so amazing when they travel with children. And all the things they come up with is just remarkable. It's remarkable.
Good, thank you. Okay, our next traveler, this is a change in pace. This actually is an 18-year-old young man, not a child, but still, shall we say, phasing into adulthood. Ben. Ben is a college freshman. He just turned 18. He lives in New York. And like a lot of his classmates over spring break, he is making a beeline for Cancun, Mexico, on the Yucatan Peninsula.
Woo-hoo.
And he's spending a week there on the beach. He comes in with his mom. They're both excited about Ben's upcoming trip. His mom is not going with him. Ben's going on his own. He is healthy. He takes no medications by prescription. He was born in the US. Concerning past vaccines, he's current on most. He had to get MMR so he could matriculate at his university. He's current on tetanus. Flu and COVID, he's not sure. He has to check. Maybe he's a little behind on those. So again, before we launch into specifics, any sort of general remarks you would make about him and his trip?
Well, advising teens when they travel is somewhat of a challenge because you're really talking to two people in the room significantly. You want your traveler to hear what you're saying in a way that they are accepting of your advice and not feeling lectured to, and not feeling frightened if you list all the things. If they're going on an overseas trip to somewhere that has many more risks, sometimes all of this information can be somewhat daunting. And also finding a way to also quell the fears of the parent who's letting the child go on an unrestricted spring break trip. I think we've all been there. And so I would go through my usual medication and vaccine and diarrhea stuff with mom or dad in the room.
Mm-hmm.
And then I would recommend, I would say, there's a few things I'd like to ask in private, if you don't mind. People are used to that now in pediatrics. They've been told that, they've been asked that question throughout their adolescence in general. So most parents are not adverse, and actually they welcome being asked to leave the room. And that would give you even just a few moments to have the conversations that you really want to have, which is, okay, this is a big responsibility, and there's a number of things. It's sex, drugs, and safety. And so safe sex, having that conversation alone is far more effective than with a parent in the room. Opportunities for problems to occur around alcohol and other drugs. And kids know this, and yet it still occurs due to their maturity level. But having the discussion that there's a lot of things that can be slipped in your drinks, that can be put in your drinks, that you really have to be able to have a friend. You have to have a safety plan with friends. Don't leave your friends alone. Don't be left alone. Moderation, and they're 18 in the US. It's not, you don't talk about this that way, but when they're in Mexico, it's a different story entirely. The third thing I like to bring up is that it may feel like a good thing at the time, but it's not a great idea. It's not a good idea at all to think about getting a piercing or a tattoo when you're on a spring break trip, because the chances of picking up something untoward like hepatitis B or HIV are present, and you just don't know. So save all of those kind of risk-taking behaviors for another day.
Got it. So it sounds like part of the visit will be with the parent present, and then at an opportune moment, you will ask the mom to step out so you can talk about some more sensitive topics. First, on immunizations, any particular thoughts for going to Cancun for a week of partying?
Hepatitis A, flu, I would make sure he's at the age that hepatitis A, again, was the routine vaccine, so he should have that under his belt. Encourage flu and COVID, just because there's going to be crowds, there's going to be, nobody's going to have personal protective masks or anything.
Right.
So
Right.
it would be a vacation buzzkill for sure. And then coming back and getting sick after spring break ahead of finals is a really big deal. And to be put out of commission for 1 to 2 weeks can really mess the semester up tremendously.
And in terms of travel vaccines, would you recommend typhoid fever or other travel-specific vaccines for this traveler?
No, I wouldn't at all. But I would urge him to not interact with animals. How many times I see everybody's playing with the dogs and the cats, and it's just, you just never know, because the dogs and the animals are largely unvaccinated, and it's just not, just stay away. And I know that's a hard thing for a lot of kids, but when they're out of the country, it's just a good safety plan.
Good. And how about bug repellent and or a medication for malaria?
Well, Cancun is in a malaria zone. If they were going into the Yucatan, into the jungled areas, but the resort areas are well sprayed, it would still be a good idea to bring, number one, sunscreen. Really important to bring sunscreen. Put it on in the morning, put it on at lunch, put it on in the evening, and put your insect repellent over top of it. And if you get one of the 12-hour insect protection, you should insect repellents, it should be fine. There is, in Central America right now, there is dengue fever. And again, in the resorts, that's not a typical issue. However, it doesn't hurt to have some insect repellent in your kit also.
Okay, good, good. Now, his plan, in addition to drinking those little tropical fruity things with umbrellas, is to try the local food. And he's heard street food is
Uh-oh.
good there. Any thoughts, medication strategies that you would advise?
Well, if you have, this is the bane of our travel medicine practice, because we try your best to avoid food that may be a vector for travelers' diarrhea. The best thing you can do then is to make sure your food is thoroughly cooked. In general, salad bars are a problem. Salad bars on the beach, which are often very popular, they can be the reason that you're in the room all day the next day. So if you eat food that's hot, eat food that's cooked, and make sure that when you're drinking water, it's bottled water or bubbly water. Bubbly water is fine. Soda is fine. If you get diarrhea, it's the same advice I would give as we gave to our little 2-year-old before. Stay hydrated. It may be a lot easier to find other hydration fluids, but if you can get someone to get you some oral rehydration, Solución Rehidración in Mexico is ubiquitously available and it works.
Okay,
So
good.
stay hydrated. I tend to not send teenagers traveling with doses of antibiotics. For a short trip, I mean, if he gets himself into trouble, he can either seek care or he can get care when he's at home. But asking them to then, on top of that, decide the nuances of when exactly to take that antibiotic may not be reasonable.
Okay, good. And within the realm of non-infectious risks, he plans on doing maybe some body surfing. Any other things that you would share with him for advice?
Again, and if he doesn't speak Spanish, I highly advise that they put Google Translate or one of the translation services on their phone and know what the sign says at the beach. If it's a high surf warning, it translates it right on your phone. You can hold it up to the camera up to the sign. Understand the currents. Ask people where you are, where's a safe place to swim. Do not use any substances, no alcohol, no marijuana, etc. If you're going in the water, really important to be sober and be aware of your situation.
Okay, good.
Also, be very careful at night. A lot of times, night swimming may be very popular, but again, there's often no beach lifeguards, and there's no option for rescue if you're stranded out there at night.
Okay, good, good. Now, maybe we're at the point where you ask his mother to step into the waiting room, which she says, of course, and she steps out. So now you're just talking with Ben. And you alluded to what some of the topics you would talk about. You would talk about safe sex and avoiding things that break your skin, like for a tattoo or a piercing. Um, Anything else within that realm now that you've just got Ben face to face, one on one?
Just don't get yourself in a situation that's going to lead to trouble. Try to stay out of large crowds. If there's big crowds of things, stay away from trouble. You're in another country. You're in totally different laws, rules, and customs that you may not be aware of. And just to keep and have a buddy system. Definitely have to have a buddy system.
Mm-hmm. Okay, very good. Now his mom comes back in and they both say, hey, we both want to read more about just everything that you've just talked about. What are some good resources that you refer people to?
Well, that's a great question. Well, I have people look for the infectious resources on the CDC.gov travel,
Mm-hmm.
and you can go down to the country and you can look at the country specific things. I'm in the habit of giving handouts, and in my own practice. So I would also refer people to traveler's diarrhea information, and there's many websites where you can go and look at now. The International Society of Travel Medicine has lots of resources on things,
Mm-hmm.
and those are my go-tos.
Okay, good. Thank you. Well, before I let you go, Dr. Mackell, I'm just going to, sun kind of came up there. Any other thoughts that you would want to share with regarding these two travelers?
Again, rather straightforward, a few little caveats, and they all should just have a wonderful trip.
Great. Well, thank you so much for your time. I appreciate your expertise.
My pleasure.